You know, in medicine, some of the biggest fights are against an enemy you can't even see. Today, we're going to go deep inside one of the most precise procedures out there, a lumbar puncture. We're going to explore the hidden world of sterile technique, which is all about building this invisible fortress to keep a patient safe.
So, what does happen right before a spinal tap? This question, it really gets to the core of patient safety. Because long before any needle even gets near the patient, this invisible battle has already started. And the winner? Well, that's decided by preparation, precision, and following the rules. Every single time.
All right, first things first. Why are we zooming in on a lumbar puncture, or a spinal tap, as it's often called? Well, this is no routine checkup. It is an incredibly powerful diagnostic tool. I mean, we're talking about something that can literally provide life-saving answers when things get serious.
The secret here is in the cerebrospinal fluid, or CSF for short. Now just think about this. This is the fluid that's constantly washing over our brain and spinal cord. It's like a liquid diary of what's happening inside our central nervous system. And by analyzing it, doctors can spot infections, bleeding, you name it, a whole host of really serious neurological problems.
And that is why the stakes are just so incredibly high. A lumbar puncture becomes urgent when doctors suspect something like meningitis, which is a really dangerous inflammation around the brain, or if they think there might be bleeding in there. These are the moments where every single second and every tiny detail absolutely counts.
Okay, so to pull this off safely, the medical team has to face an enemy they literally cannot see. We're talking microscopic microbes. And this really gets us to the fundamental challenge of pretty much any invasive procedure.
The big bad guy in this story is something called an HAI. That stands for hospital-acquired infection. And it's exactly what it sounds like, an infection a patient picks up while they're getting medical care. This is the exact enemy that sterile technique was invented to defeat.
And this is where it all connects. You see, one tiny little break in the rules, it's not just a small slip-up. It can lead directly to a patient getting an infection, and that means more suffering for them and honestly a huge cost to the entire healthcare system. So getting this right, it matters. It matters on every single level.
So the big question is, how do you fight an enemy you can't see? Well, you build a fortress, a sterile fortress. Now, we're not talking about stone walls and a drawbridge here. We're talking about a carefully, meticulously built environment where the risk of contamination is pushed down to the absolute minimum.
And the number one rule of building this fortress? It's all about timing. I mean, you wouldn't leave the castle gates wide open for hours before a battle, right? Same idea. The sterile field is set up just moments before the procedure starts. This minimizes how long it's exposed to stuff in the air or, accidental bumps.
The foundation of our fortress is what's called the back table. This becomes the main sterile command center, and the rules here are super strict. Anything, and I mean anything, below the height of that table is considered unsterile ground. Don't touch it. Even moving the table is a careful operation. You grab it by its lower leg, way down low, to make sure you don't risk touching that pristine sterile top.
Yeah, this is the level of detail we're talking about. There's a 1-inch border all the way around the edge of that sterile drape that is considered contaminated. Think of it like a moat around the castle. You can bring supplies to the edge of the moat, but you never, ever cross it with something that's supposed to be sterile.
Okay, so how do you get your weapons and tools inside the fortress? It's done with this very specific, almost choreographed sequence. You open the outermost flap away from your body first. Why? So you never have to reach your arm over the open, sterile item. Then you open the sides, then the last one towards you. And finally, you gently kind of flip the contents onto the field, making sure your hands never break that invisible barrier, never cross into that sterile airspace. It's like this very precise, deliberate dance.
All right, the fortress is built. The field is ready. Now the focus turns inward, to the person actually doing the procedure. And let me tell you, this is not just washing your hands. It is a systematic process that honestly feels way more like a ritual than a quick scrub.
And here's a little reality check for you. The goal isn't to do the impossible, which is to completely sterilize human skin. That can't be done. The real goal is to get the number of microbes way, way down, to the lowest possible number. It's all about reducing the risk, not completely eliminating it.
Just look at the discipline this takes. There's a reason it's called the counted scrub.
We're talking 30 circular strokes just for the nails and cuticles, then 10 strokes for each of the 4 sides of every single finger. It's this incredibly methodical process designed to make sure not a single surface is missed and that every little area gets the exact same rigorous cleaning.
And then there's the golden rule that governs this whole thing. Always keep your hands higher than your elbows. Always. By doing this, you're making gravity your best friend. All the water, the soap, and any microbes that get washed off, they all flow downward, away from the cleanest area, your hands, down toward the less clean area, your elbows. Simple, but brilliant.
So, the fortress is secure, the practitioner is prepped, and only now, after all that, can the actual procedure begin. So let's go inside the lumbar puncture itself. First up, how the patient is positioned. And this isn't really about what's most comfortable, it's all about the clinical goal. Having the patient lie on their side in a fetal position, that's what lets doctors get an accurate read on the fluid pressure, which can be a super important clue. But sometimes the sitting position is just more practical, especially for patients with obesity.
And here's the whole procedure in a nutshell. First, they find the exact right spot in the lower back, just by feeling for the hip bones. Then the skin is prepped, it's numbed up with some local anesthetic, and the needle is advanced very, very slowly. Once it's in the right spot, the CSF fluid is collected purely by gravity. You never pull it out with a syringe. It just drips into 4 separate tubes, ready for the lab.
And check this out, this is a really cool little piece of medical innovation. A really common side effect from this procedure used to be a nasty headache. Well, it turns out that by changing the shape of the needle tip from a sharp cutting kind to a dull pencil point design, they could just gently separate the tissue fibers instead of slicing right through them. That one tiny change dramatically reduces the risk of that headache. Just a small tweak, but a massive improvement for the patient.
Okay, let's pull back for a second and look at the big picture. All these individual steps we've talked about, building the fortress, the scrub ritual, the procedure itself, this isn't just about ticking boxes on a checklist. These are all pieces of a much bigger concept, a culture of patient safety.
Because what happens when that culture fails? Well, the consequences can be just devastating. We're talking infection, bleeding, nerve pain, and in the absolute worst case scenario, something called cerebral herniation, where the brain tissue actually gets pushed out of place. It's a really sobering reminder of why every single one of these steps is completely non-negotiable.
So, when it comes right down to it, sterile technique isn't just one person's job. It's a shared responsibility. You could even call it a sacred one. It takes flawless coordination between the doctor, the nurse, everyone on that team. Every single person in that room is a guardian of the sterile fortress.
And that kind of leaves us with one final thought, doesn't it? When you see this level of incredible attention to detail, this blend of hard science and disciplined ritual, you have to ask yourself, are we just watching a medical procedure, or are we actually watching a team of people fulfill a deeply profound promise to protect the patient in their care?